Art Pharmacy is a arts-based social prescribing company. We were founded in Atlanta, Georgia in we had about 6 to 8 months of design starting in the fall of 2021, started receiving referrals in Atlanta in 2022, and since then have expanded to be able to serve North Georgia, across the state of Massachusetts, in New York City, and as well as in California on Stanford campus. We are really, really excited to add Connecticut to that list, being able to start to fill prescriptions later this year in the fall. We are currently in the middle of this ecosystem building of building both the arts and culture side, which we'll talk a lot about today, as well as the kind of healthcare side of things, those folks who will be the referrers. So that's all happening right now. Um, Exciting times for sure. Okay. So social prescribing, as you'll hear me talk about, is just a means of enabling healthcare professionals and other trusted individuals to prescribe community-based social interventions as supplements to traditional clinical and pharmaceutical care. Social prescribing is a mechanism. It is like the infrastructure or the bridge between these two fields. And when we start talking about arts-based social prescribing, it narrows things down a little bit. So social prescribing itself was started in the UK in the early 90s. And it was this connection to a whole range of non-clinical community-based activities, um, volunteerism, time in nature, food, kind of your more traditional social drivers of health needs, as well as arts and culture. In the US, we're primarily talking about arts, nature, and sometimes food as medicine when we talk about social prescribing. But this kind of marriage, this kind of focus of the mechanism of social prescribing plus the field of arts and health is where we come to this like magic spot of arts-based social prescribing, also sometimes called arts on prescription. So lots of different ways to talk about it, but they are generally talking about this idea of tapping into the power of arts and culture to support someone's well-being, mental health, physical health, social well-being, etc. The arts and health field, you'll probably know, has been around for 40, 50 years with lots of academic institutions that have studied the impact of engaging with arts on both our physical and our mental health. And then, which really just represents and or reflects the centuries of lived experience that we all have as communities, creatives in community, to be able to put words or put science behind what we see, the impact of creative work being on those that we create alongside, create with, teach, perform for, etc. Um, One of the things that has excited me so much about this field of arts and health is adding that language of science to it, to kind of what we already know. And this quote from the NeuroArts Blueprint, which was the precursor to Susan Maximin and Ivy Ross's book, Your Brain on Art, which if you haven't read it, read it. It is like the coolest way for an arts person to conceptualize science. Me, not a scientist, but it's amazing. And I just cannot share this enough. That physiologically, they can track that the stimulus from art on our senses causes a cascade of reactions that affect multiple biological systems and alter our brains and bodies. In short, we are wired for art. Like, how cool is that? So that's really the basis of our work. And so we can kind of, we'll tease that out a little bit more later. But an additional kind of piece of social prescribing before we move on is that all of the, or most of the studies that are coming out of the impact and evaluation of programs are coming out of the UK and other countries that have a more socialized health system. So the rollout in the US looks a little bit different, but we are seeing the same outcomes. And those are increase in self-esteem and confidence, mental well-being, positive mood, reduced anxiety, reduced depression. We're also seeing impact on physical well-being, And definitely in the space of loneliness and social isolation, being able to improve people's sense of connection and sense of belonging, those are those have we've seen those in our work with Art Pharmacy as well. And this is where I said Cassandra will know this well. Um, Sometimes in thinking about arts-based social prescribing, I like to think about the whole field of arts and health and the various columns or kind of pathways within it to kind of understand where social prescribing falls. So we have your creative arts therapies, which are probably one of the things that we're most familiar with, which are clinically licensed professionals that utilize arts-based activities such as music or dance to help treat emotional and mental health conditions. It's a clinical practice, licensed professionals, creative arts therapies. Then you have arts and health, which are the co-located programs that we think of like bedside music or artist in residence, that brings the arts to the healthcare systems. It's typically a non-clinical practice, doesn't have to be, but that is bringing arts into healthcare. Arts-based social prescribing works in kind of the opposite flow. So it's bringing people out into the community, connecting people with community-based creative engagements. And it's this mechanism to navigate between the healthcare settings and the community. It is, by definition, a non-clinical practice. Um, the uh, I guess social prescribing, you could connect someone to creative arts therapies, but we are typically looking at non-clinical practices, tapping into the essential protective and therapeutic benefits that engaging creatively has um, for our well-being. So what this looks like in practice is that uh, a healthcare provider or another trusted community member who's in the art pharmacy kind of network of providers, we call them prescribing partners, will identify a need and write a prescription or make a referral for their client or their patient to engage creatively. That individual ends up with Art Pharmacy, where they get connected with a care navigator who's on our staff, who goes through an intake process with them, where they learn the members' health goals and their arts interests and their access needs, and then makes a tailored recommendation of 4 to 6 engagements that are happening in their community from one of our arts and culture partners. And then the person gets to choose which of those really speaks to them, um, works for their schedule, all that good stuff. And then the care navigator does the logistics of booking the ticket or registering for the class on their behalf. So all the person has to do is really easily show up, experience their chosen activity, and receive all of those benefits. I'll pause there to say, at the time of booking, Art Pharmacy covers the participation costs, so it's always free to the member, but the arts partners get paid for anyone that we send their direction, whether it's the member or a companion. So we always offer a companion ticket as well, so that if somebody needs to go with a caregiver or a loved one or a friend, they're able to bring someone along with them. After each experience, the care navigator follows back up with the member and checks in to see, did they make it? How did it go? Is it moving them towards their health goal? We do a handful of well-being assessments that then we share back with the referring provider. So it really creates this closed loop system that I think differentiates social prescribing from kind of just a community referral that doctors have, done for many, many years. We also use that information to inform the next set of offerings for each member, because a typical prescription is for 12 months of about monthly engagements. So each month, as we're checking in, we're really helping members hone in on what's most effective for them, what is bringing them the most joy, the most impact, um, to build that journey alongside them. The different types of engagements, as you can imagine, the people that we work with are very diverse. They have a really wide range of interests and needs. And so the network that we build needs to reflect that. So we look for really robust partners with a diverse set of offerings that include your traditional visual and performing arts, as well as kind of the broader umbrella of culture. So, traditional arts, history, historical museums, botanical gardens, architecture walking tours. We've got all of those that are very cultural, but not necessarily traditional visual and performing arts as well. We connect people to in-person programs the majority of the time. About 85 to 90% of folks select in-person programs, but we do have virtual and even telephone-based engagements so that if somebody is housebound or, is looking for a very specific thing that doesn't exist in their area, we do connect folks virtually as well. And then we think about kind of the levers of change for folks. There's a number of different pieces that kind of make an experience, work on our bodies differently. And so some of the things that we think about in those are both the types of experience and the way that people participate. And so as we think about like individual participation, where maybe somebody goes to visit a gallery or goes on their own to see a film screening. Uh, that is one way, is maybe someone who's looking to kind of unplug for a minute, reduce some stress, just have some time for themselves might be one connection. Um, Whereas somebody who is looking to build that relationship, um, feel more connected, feel the sense of community, looking at participatory options, something like maybe a workshop or a class or a community conversation or a walking tour where they get to be really engaged and kind of part of the experience, may be something that is going to be more effective for them. So in any case, whatever we're offering to folks, we screen for contraindicators and make sure that we are offering the best options for folks considering cultural background, age, geographic fit, to make sure that people feel really successful with whatever they connect to. So that standard of care is kind of our guide stone for what all of the experiences that somebody might attend through our pharmacy are supportive of. And that is that they center a creative or cultural process or product, that they promote inclusivity or they practice inclusivity and promote a sense of belonging. They offer a chance for reflection, that there's mutual respect and agency for the member, and that there's a chance for connection and engagement. Now, depending on the type of program or type of offering, this looks different for each event or each engagement. Um, for instance, if someone is going to a ceramics class, small group, this connection and engagement may look like just talking with the instructor, communicating with the folks who are in the class with them, um, lots of connection, lots of engagement. Or that may be, someone who's going to a theater show and they walk in and they get, greeted by an usher at the door and they have a moment of humanity. And then the connection is really through this like shared experience of witnessing a piece of theater with the other folks in the audience. So those look very different, but there's still that an element of that piece to it. Like I said, we are building the ecosystem in Connecticut. Um, some benefits for arts partners. We do pay you for each member that we send. It's a way to think about kind of building your audience. There's no reporting requirements. So since the care navigator follows up after each experience, arts partners are not required or not asked to share back on, did people make it or anything like that. In some cases, you may not even know, which person walking through the door is from Art Pharmacy. If you think about, a gallery or a museum that, maybe they know that there is a ticket that's been bought by Art Pharmacy for somebody today, but, when you've got 500 people walking through your doors, which one came from Art Pharmacy? doesn't matter, don't need to track it. Um, but then you do get access to resources and trainings. And these include resources to share with your colleagues and staff, like your box office, front of house visitor services, so that somebody does walk in the door and say, I'm here with our pharmacy. What do I do? Where do I go? That they get greeted with, yes, welcome, you're in the right place. Let's figure this out and answer your questions, as opposed to, I don't know what you're talking about. Never heard of it. You're in the wrong place. Um, so I do an orientation for partners after they've enrolled, and they get access to a resource hub. So if you have not already and you feel like this is a good fit, you can start that process of joining the network today. Otherwise, I'll share the link out after this along with the slides so that you're able to start that process. These are some of the resources and research that I talked about, the quote from NeuroArts Blueprint and Your Brain on Art, and some additional resources as well. Okay, that is me, but I'm going to stop sharing.